alama, noi. Amasoko buli wengala ya see sunshine. Endowooza bwe kibeera baby nga you are mine. Mubalolebe nakusanga nga tuli mu dance. Enkusaba tuzineko nawe omunyigo squeeze. Kakuba kyengamba olabika nga atanchenga. Baby manya buli kyoyenda nekikuwa akabuno nenda.
Malnutrition in Uganda is really a very big problem.
Malnutrition is a rampant problem. Some of the children don't get to eat even a meal a day. So there's scarcity of food. They don't get adequate food intake.
The evergreen kind of climate, the vegetation is actually changing. The rains are no longer that we used to know.
Obunye surround week dora loinye salusity odoi mamu era nyona nen motumotu bado motumoru.
Food security is an issue.
They don't get good yields, then they have shortage.
Globally, 45% of children deaths are associated with malnutrition.
And in 2020, 22% of the children were stunted. That means too short for age.
45 million children were wasted. That means that they're too thin for their height.
With Sub-Saharan Africa contributing to 1/3 of all cases of malnutrition.
Uganda is ranked 13th in the world by UNICEF based on the number of stunted children in the country. 3 in 10 children in Uganda under the age of 5 are stunted, and 3.5% of the children are wasted.
According to the government of Uganda, 1.6 million cases of illnesses have been associated with malnutrition. For example, over half of the children in Uganda under 5 suffer from anemia.
This has a great impact on the economy, as 5.6% of the annual GDP is spent on treating malnutrition and associated illnesses.
I definitely know that malnutrition is a big problem, and much of this has been because of the poverty levels contributing to the prevalence of high malnutrition rates in the country, and more so in the East, because in the East, because of the issues of climate change and so forth, there's a lot of drought. Food security is an issue.
It's a multi-sectoral approach. It's a broader, it has many angles as to how it's caused. Okay, there are social factors, there are biological factors, there are environmental factors. So you have to assess where is it coming from, then you intervene. So we're going to involve the health workers, we're going to involve the local leaders, we're going to involve the religious leaders, we're going to involve the social workers, and then you're going to involve even the political leaders, because they are key. They play a role in ensuring that they talk to the masses, they educate the masses about the importance of eating good diets, especially using the local available foods. Yeah, so all this information is very key, especially in the community health aspect of malnutrition prevention. Then young child mothers who have children and they're ignorant, they don't know how to feed the children. Okay, so it's quite broad. And children who have chronic diarrheal diseases and pneumonias and HIV and TB are predisposed, they're at risk of slipping into malnutrition. Cultural practices which are negative, which are not good, for example, abrupt weaning of children from the breast. They stop children from breastfeeding. 2, children are exempted from eating nutritious foods, claiming that the foods are for the elders. For example, like eggs and chicken. In the past, they used to say, no, these are only for the wazee to eat. The children should not eat. So when the old men are eating chicken, the children should not eat. The eggs are for the old people. Okay, so this has been happening, and in the past, but I think of late things there's been a bit of a change, behavioral change in the communities.
You know, in the community, people have their own perceptions about malnutrition, and they don't take it as something very serious because maybe they lack a knowledge, maybe they don't know it is malnutrition, maybe they think it is another thing, and then there is also a problem of poor health service seeking behavior among our people. You find that the child is sick and they just buy, somebody goes on buying their own medication, and they really don't detect what is the cause.
Many times, if you look at it, what we call the fertility rate of Uganda, I think the last time I checked was around 8 point something. Now, if the numbers are heavy, many times these families are not able to sustain because cost of living in Uganda is growing. Cost of education, cost of health, cost of feeding. Okay, so if you have a big household, definitely you're not going to be able to sustain that family, and that is one of the consequences of large families.
Kauna buto ringo langire jautene do bichogor tai pwedu toma lale kale noi.
Who will do it?
Dolto se maro joker dolto se dwa kaisaka. Ai ni nyam to ja chede kada. Naro ponok na inse TB, ponok na inse senda.
The evergreen kind of climate, vegetation is actually changing. The rains are no longer that we used to, the way we used to have. Either they have diminished, or if they tend to come, they come in very heavy downpour and kind of also destroys the plants, and that causes a lot of food insecurity. The impact of malnutrition to any person, a healthy person contributes to economic growth in any community. Now, malnutrition causes reduced immunity to any individual. And when you have ill health, it's a circle. Malnutrition disposes you to disease disposes you to malnutrition. And the longer you are bedridden, the more you are less going to be productive. So the more the children are sick, the more they are not able to eat, and the more they are most likely going to be prone to getting malnutrition.
The impact of this malnutrition to the family is one. When these children are so sickly, you find that the income of the family is also affected because the family is not able to produce what they are supposed to. Because every time the child is sick, they come to the hospital, they take most of the time there. And then also medication is also expensive. As the community, when you're sickly, you cannot produce. That means they will realize low labor in that community, and it also brings an impact to the hospital. These malnourished children are prone to death, so the mortality rate will go up. At the same time, they also affect the income of the hospital, because most of the time they come to the hospital and they fail to pay the bills, not because they want, but down there in the community they don't have any access to resources. It is very, very expensive to run a nutrition unit, because we are dealing with the people who are not able to pay their bills. They are not able even to feed at home. How do you expect them to come to the hospital and then they change all of a sudden? So feeding a malnourished child is very, very expensive, because in Formula 100 or Formula 75, we need sugar, we need cooking oil, we need the minerals, and the minerals are only got from France, CMV, which is also very expensive. So if it was only for the hospital, I know we would not manage.
As a hospital, we feel that it's also, it increases the burden on us as a hospital to deal with cases of malnutrition. Because of the low lower intake of nutrients, there is impaired immunity. When a child is undernourished, the child is not able to have enough energy. The child needs glucose, and needs all those nutrients, okay, those biomolecules, bioactive molecules, to facilitate immune function. So we find multiple infections, can be chest infections, can be urinary tract infections, can be brain infections, because they're having this deficiency at the time when their bodies are growing, are developing, okay? So for example, there is always, you find that children tend to have poor performance in school over time because they haven't had adequate brain development, okay? And most of the malnutrition comes at the time when the children are really at that critical time of brain development. That is from the first 2 years. The individuals are not able to ascend the social ladder, and then they go into, because of frustration, they go into alcohol abuse and the other crimes like theft and doing odd jobs and stuff like that. So I think the impact, the socioeconomic impact is quite big on the country, the community itself, and the country as well. Yeah.
We do community mobilization, sensitization, and then we conduct outreaches. And the outreaches, we use the VHTs and community mobilizers to mobilize these people, bring them together in one small community. There we go as a team from the hospital. We go down there, we do nutrition assessment, we use mock tapes, and then we refer those ones who are severe with acute malnutrition to the hospital. And even we refer those with the acute malnutrition without complications for an outpatient therapeutic care. As we go in the community, we make sure that we sensitize the mothers. They have to understand the need for them to come to the hospital, take care of their children, because if we brought those children to the hospital and we started treating them, the mothers will not learn. That means after discharge, when we take them back to the community, still they have not learned. So that's why we bring them here, we teach them. As they are here, they also try to do work that can really motivate them. When they go back home, they can also practice what they have learned. And they can also go back and teach others, and even they can refer other children. So that's what we do. When these children are identified in the hospital, in the community, and they are referred to the hospital, first we consider medical side. They have to do all the tests that are necessary to detect what kind of infection these children have. After that, then the children are put on the F75. That is a starter formula that is given to a severe acute child with malnutrition. And in that formula, it is something with a low proteinous diet that helps the child regain the appetite, and then also stabilization. It is a stabilization phase treatment. So, and then after we shift them from stabilization to rehabilitation, whereby we give them the catch-up formula, and then we introduce them back to the normal diet, the family diet. And then as the treatment goes on, because we need to treat the cause. What brought about malnutrition? Some of them it is because of infections that are not managed well. Some of them may be because of the poor situation at home. But mostly, these children come with infections. That needs to be treated first. So far, from that year of 1998 up to date, we have admitted 3,522 patients have gone through that, the nutritional rehabilitation.
During the time of during the transition phase, you now begin to do a lot of the psychological care now. You want to institute stimulation and play therapy interaction with the mothers. You want to sit down with them and discuss with them, see where the problems could have been, how they can be addressed, engage them and try to get their views on how they've been managing their children at home. Encouraging breastfeeding, okay? You have to continue breastfeeding. Looking at issues to do with family planning, okay? Because some of this malnutrition could be due to the fact that the child was born was weaned off.
Jai Bernara tumu kwa na nyisi si boy kijoda mam epedor kwa nyisi e boy gante jo nyisi
Ambua nga wanya jula kineta nejiko kubwa chame nyam alaka kine bole da kwa nelia ida kwa na.
To eradicate malnutrition, it's a great deal of community sensitization, empowering the communities. You don't need a lot of money, but information about what is locally available to the mothers, to the families, to use what we call food security could help in cutting down a lot of malnutrition. So health education is very important.
And then when people can practice good behaviors, like living mother and their father taking full responsibility to bring up the child. But most fathers, they prefer drinking, leaving these mothers alone, and then they are not bothered in the morning. They don't mind about the children. They leave the children to the mothers, which is not correct. So we need to sensitize the community so that they come to understand these things.
Also, the mother should be taught how to mix local available nutritious foods, which can complement the diet and help to give an all-round diet which is nutritious, which can help the child to grow. Using the local available foods. We need to increase coverage and access to this information because there's a lot of ignorance because of the literacy levels in the community is low. So they need to access this information. Like for Kumi Hospital, we're having challenges because we only do on average 4 outreaches in a month. That is very small considering the area because we have catchment areas Bukedia, Kumi, and then Ngora. So we're only doing 2 districts. This is Kumi and then Bukedia. Yet we have Ngora, which also is quite big, but we can't access because of the logistical problems. We have problems with fuel, and so sometimes they have to integrate the community health program, that's the public health program, to go. But for nutritional care, you need to go to the communities, to the families.
It's important to create awareness about malnutrition because you know for sure that a good nutrition contributes to a healthy and a health being and somebody with a good immunity. And if your immunity goes down, you are prone to getting a lot of diseases attacking you. And if you have a lot of diseases attacking you, it will be like a circle, an endless circle, which never stop. So, as far as having a strong body that is able to fight diseases, food is the first medicine.
Rangechora na kini lucheda wamekulia karosa yao mikoko.
Alama no